Good evening, everybody. I am Dr. Venkataraman, practicing nephrologist. Over the past 15 years experience in the field of nephrology, I am practicing nephrologist and director of KVR Kidney and Diabetic Center, which is located in Vellore, Koteri bus stop, Vellore. Today we are going to discuss about the CKD. What is the causes and what are the symptoms of CKD? So most of the people know what is CKD. CKD is nothing but chronic kidney disease. Any kidney disease which is present more than 3 months. That is a permanent, which is for the local to colloquial language to explain to the patients. It is a permanent kidney disease. But when it is present more than 3 months, it's going to be a permanent disease. So it is difficult to cure. So our aim is to prevent the progression. So the kidney disease, any kidney problem, whatever any problem, any anatomical problem in the kidney, or any physiological problem like proteinuria, or any problem persistent more than 3 months, mainly that any hematuria or proteinuria or any decline in kidney functions, the GFR less than whatever as you know, the normal GFR is 100 to 125. So it's according to the GFR, the CKD is classified into 5 stages. So the stage 1 is greater than 90 with any comorbidities, and stage 4 is mainly it is 90 to 60, and stage 3 is 60 to 30, and stage 4 is 30 to 15, and less than 15 is called the stage 5, that is otherwise known as end stage renal disease. So what is the importance of end stage renal diseases? It is a stage where you have to do some renal replacement therapy to progress the patient's life. For example, if you are not able to do the renal replacement therapy, the patient will die. So the most common renal replacement therapy is hemodialysis, other is peritoneal dialysis, and the most important, the renal replacement therapy, which is a good standard of living and also good quality of life, is renal replacement therapy, renal transplantation. So even the thing is, even though there are a lot of people waiting for renal transplantation, it is the better alternative for mainly those who are in second or third decade or the young age. Those who want to live more than 20 or 30 years, better they go for the renal transplant, because the average expectancy of the life in the CKD patient is only 3 to 5 years in hemodialysis. So what are the symptoms of CKD? Say, who are the high risk for CKD? So mainly the patients who are in high risk for CKD is mainly the patient is a known case of diabetes, already a known case of hypertension, especially those who have hypertension in the younger stage. These are the hypertensive patients, diabetes patients. The patients have recurrent UTI, especially the males with recurrent UTI, and already the patient who have familial disease like ADPKD, the patient who have already taken or treatment for the glomerulonephritis. These are the patients who are high risk. Patient can develop CKD, so they should be very careful. So what are the symptoms of CKD? What are the presenting symptoms? The worst thing is some patients may be asymptomatic till the decline of GFR is even in the CKD stage 5. So sometimes they may be asymptomatic up to stage 5. That is the worst thing in CKD patients. So the main presenting symptoms is pedal edema, swelling over the face, the periorbital edema. Whenever the patient get up from the bed, they might have noticed that swelling over the eyes and a facial puffiness, the swelling over the face, or the pedal edema, or the long-standing, or they will develop the swelling over the lip, and the breathlessness. If the pedal edema is more, the volume overload, they will have difficulty in breathing while walking, and the headache. When there's hypertension, they can develop headache. In advanced cases, they will have loss of appetite and vomiting. So they won't have any appetite, and whenever they won't be able to take any food. They will have vomiting. They will have vomiting whenever they take a small amount of food. So these are the main common symptoms. Another symptom, because of anemia, the patient has severe tiredness and weakness, lethargy, and they have headache because of hypertension. These are the symptoms. The patient have UTI, they have increased frequency or urgency, all the lower urinary tract symptoms. These are the patient with the UTI. So these are the symptoms. If the patient mainly, they will develop, these are the presenting symptoms. What are the signs where you can develop? As I told, that the important signs are facial puffiness, volume overload, pedal edema, severe pallor, and sometimes the patient have breathing difficulty, the cramps and all this. These are the symptoms. So how they can prevent the CKD is one important thing is those who are high risk, they have to know how is the kidney, how their kidney is at least yearly once, and they have to at least get one appointment with the nephrologist Early ones, those who are high risk, that is diabetic patients, hypertensive patients, and obesity patients, smoking. Those with the smoking is the high risk patient because the smoking can lead to damage to the kidney. And even the patients, mainly the old age people who are on chronic NSAID intake, they will land up in chronic interstitial nephritis. So, and even the patients, sometimes the patients who are taking natural medicines like Siddha and allopathy, sometimes that can lead to allergy to the kidney and they will land up in acute interstitial nephritis. These are the patients they should be careful, and and they should get at least yearly once appointment with the nephrologist to know how the kidneys, especially the diabetic patient, because the most common cause for CKD is the diabetes. So they should be very careful. And another important thing is how to prevent the progression of CKD. The progression is mainly they have to control the diabetes, they have to control the hypertension. For the hypertensive patient, the best advice is to keep the salt low in the food. The advisable salt limit is only 5 grams per day. That is only the 5 pinch of salt per day. That's the advisable thing for the CKD patients. Especially the patient is on volume overload, they have to restrict the fluid. And the patient in advanced kidney disease, they have to decrease the protein intake because that is a stress to the kidney. So the high protein intake can lead to the progression. So most screening test for the diabetic patient is that microalbuminuria. Even before they're developing renal failure, they can be able to they will throw the protein in the urine. So the small amount of protein which can be detected, we can by using a early morning urine sample. If you do the microalbumin, you will come to know the patient is going to develop diabetic nephropathy. So you should be very careful. The ultimate thing is you have to control the blood sugar. And the hypertension, as I told that you have to keep your beauty less than 140 to 90. And if you are hypertensive, you should restrict your salt and you should avoid pickles and puppets. And another thing is that which is a food which is rich in salt, like all the fried items and the what is that dried fish and all the things you should be very careful. So this is a thing where you can keep your BP less. And also another important risk factor is also obesity. So the important thing is you have to fit your body, you have to keep your BMI less than 25. So the best thing is whenever what is that height in under minus the height in centimeter minus 100 is that ideal weight. For example, if your height is 171 centimeter, your weight should be less than 71 kg. That's the ideal weight. So you can easily you can keep your BMI less than 25. That is the important thing. And another thing is that so these are the prevention. So another important thing is that, as I told that RRT, the most common thing is that renal replacement therapy, hemodialysis. Now the people they are keeping hemodialysis. Another important thing, what are the symptoms? So the presenting symptom is the pedal edema. So the pedal edema that shows that the patient is a volume overload, there's the excess fluid. The most common cause is the CKD. Another common cause is the nephrotic syndrome. Nephrotic syndrome, where there is some damage in the kidney, that allergy that can lead to the proteinuria. Normally, a person can throw protein up to 150 grams per day. Up to 250 can be acceptable. But if it is more than 500 milligrams in 24 hours, it's definitely some pathology inside the kidneys. There is some parenchymal damage. But if it is more than 3.5 grams per day, definitely it's a nephrotic range proteinuria. If it is associated with hyperlipidemia, hypoalbuminemia, and pedal edema, if it's a nephrotic syndrome. So in this patient, there is definitely pedal edema because of hypoalbuminemia, because the albumin, because of the oncotic pressure, it keeps the fluid inside the vascular compartment. When there is hypoalbuminemia, there is a seepage of the fluid from the intravascular compartment to the extracellular fluid compartment that leads to the edema, especially that what is it? Dependent edema. Whenever the patient is standing, that will lead to that of the pedal edema. Whenever the patient is lying, that leads to the sacral edema. When the patient sleeps more, that leads to the periorbital. So the dependent edema is a classical of CKD. Wherever it's because of the gravitation, even the edema is present, even the CLD or CCF and CKD, but that periorbital edema is a classical for nephrotic syndrome. So in this type of patient, the patient is on volume overload, they have to restrict the fluid because whenever they drink more fluid, it will land up in the pulmonary edema. There is a fluid accumulation in the lungs. There is one of the dreadful complication because the patient will even they will go for the severe pulmonary edema. They can go for cardiac arrest also. So they should be very careful when the patient is having pulmonary edema. So these are the things they should be keep in mind regarding the volume more. So because we are giving diuretics to increase the urine output, even if you give the diuretics, unless they are restrict the fluid, they will end up in pulmonary edema. So that is not nothing. There's no use of giving diuretics if they didn't restrict the fluid, because when they are taking more liter of water fluid, that will lead to the pedal edema and breathing difficulty. So this is regarding the talk of the symptoms of the volume overload and the CKD patients. So whenever the CKD patients, we should be careful in restricting the water and restricting the salt. That is very, very important. And another important thing is when they have advanced renal failure, mainly in the CKD stage 4 or 5, they should be able to restrict the protein also, because that will lead to the progression. And they should restrict mainly the NSAIDs, especially when the patient is that is unstable renal function. The patient is an AKI, they should restrict NSAIDs, they should restrict ERPs, and whatever the nephrotoxic drugs, because that will prevent the progression of AKI. And the patient is already a patient is a AKI and the recovered, still there is some damage in the kidney parenchyma. So whenever the chance, they will again go to the CKD. So they should be very careful. And another important thing is that renal transplantation is the best thing to increase the standard of living and also the quality of life. But there's a lot of problem because it is very difficult to get the donors, suitable donors. For example, only the live related donors, only the close relative, the blood relative only can able to donate the kidney. Especially if the patient he can get kidney easily as a live relative, as a close relative from his brothers and sisters, their siblings, or father, mother, or son, daughter, or even grandfather, grandmother, even grandson, granddaughter. And one more unrelated thing, that related blood related unrelated thing is that wife. So these are the people that can able to donate the kidney and you can proceed with the renal transplant. But if you are not able to get the renal, that is the kidney, then there is another thing is called deceased donor. That is the cadaver, deceased donor. Whenever the patient will have any brainstem damage or the brain dead patient, they can donate the kidney. Even they can donate even up to almost 12 organs and 12 things to the, including the tissues and organs to the others. So they can, that's the important thing. One can donate the 2 kidney and the brain dead donor can donate the 2 kidneys. So 2 patient is going to benefit. So when there is no suitable donor, we have to register the patient as the diseased donor. So they will get the kidney according to the senior. That is the priority and seniority, and it will be based on the blood group also. Because the most common thing is that ABO compatible renal transplant, what we are doing, but now we are going with the ABO incompatible also, even though the risk is a little bit high and there's a more immunosuppressant. We have to do the plasmapheresis and all the things, and the cost is also a little bit high. But we are also succeeded now with the ABO incompatible renal transplant also. So that's the important thing in the progress of the renal transplantation. So this is about my advice to the mainly for the renal failure patients. So the high risk patient like diabetes, hypertension, smoker, young hypertensive patients, and the male UTI patient, and also familial renal disease like ADPKD patients and the NSAID intake, chronic intake. These people should be very careful, and they should get at least nephrologist opinion once in a year, even the kidney function is normal. So thank you. I am just closing my thought, and I hope it will be helpful to the public. Thank you.